Hello, I'm Vicki Anderson. Today I'm going to be talking to you about mental health consequences of concussion, an area that I've become interested in over recent years. So what are my credentials? So I'm the Director of Clinical Sciences Research at the Murdoch Children's Research Institute in Melbourne, Australia. I'm the Head of Psychology at the Royal Children's Hospital, and I'm also a Professor or Fellow at the University of Melbourne. My interest and expertise are across three different areas. So clinically, I'm a paediatric clinical neuropsychologist, and I've been working with children and families now for 30 years or so. My research interests really emerge from my clinical experience, and they're in cognitive, social and emotional consequences of early brain insult and traumatic brain injury in particular. And I'm relatively new to the field of child concussion. Lastly, I very much enjoy training, teaching and mentoring young health professionals, hopefully in the areas that I'm interested in, and hopefully improving their knowledge of child concussion. So today I'm going to talk to you about Take Care, which is a multidisciplinary clinical and research program that's happening on our campus. There's a number of groups that are involved in this project, and I've listed those on the slide, but I just really want to focus on two groups that are not commonly involved in the concussion field in Australia. And the first of those is our local paediatric rehabilitation service, and it's great to have them involved because they provide a significant clinical input to our work. And secondly, our mental health service, which again is not commonly involved in the treatment of and management of concussion in kids. So the research aspects of Take Care. Our overall aim is to improve our understanding of child concussion with a focus on what's relevant for the acute ED context. And we've chosen the ED context because of its critical importance as often the only point of contact that a child and their family will have with the health field after a concussion. Specifically, as many other studies do, we want to plot recovery curves, we want to identify acute predictors of delayed outcome. We want to develop an evidence-based guideline set for use in the emergency context. The design is prospective and longitudinal. We have a number of time points beginning with pre-injury data, which is collected on presentation, acute data in the ED, and then we collect data at 3 days, 2 weeks, 1, 3 and 12 months post-injury. And while this is a very broad study, my specific areas of interest are in post-concussive symptoms and their relationship to mental health factors. So what's working from the clinical point of view? Well, I think that the multidisciplinary model has been extremely helpful in combining expertise from multiple disciplines and vastly broadening our knowledge and understanding of the symptoms that we see after concussion. In addition, I think we've managed to educate health professionals about normal and abnormal recovery courses post-concussion. The establishment of a new clinic has provided clinical services previously not available to children who've had concussion at our institute. We have the opportunity to observe the wide variation in recovery pathways, which I think sometimes isn't clear from the research that we read. And we also have the ability to be able to get feedback from families regarding what's helpful and what's unhelpful or impractical in terms of the management strategies that we're suggesting. So what's working in terms of our findings? If I can, I will go through some of the very early findings that we've got from our pilot work, which is showing that between 30 and 40% of the children we see have continuing symptoms or delayed recovery for 2 weeks or more. Happily though, while this recovery is slower than what we might see in adults, the majority of our sample, and that would be 95% plus, recover fully from their concussive injuries. We've identified, similar to other projects, a number of predictors of slower recovery. Those include prior concussions, more severe acute post-concussive symptoms, as well as higher pre-injury scores, which is relevant to the mental health issues. Premature return to school and play, which can sometimes cause a bit of a decompensation, particularly in kids that have very high expectations of themselves or are very high achievers. And we're just really touching on the issue of psychosocial predictors, which include child temperament, some of the points I've already mentioned, prior mental health problems, including mood disorders, particularly trends to anxiety and depression. And family conflict and distress is also a factor. And those of you who work with kids who have concussion will know that very frequently parents differ dramatically in their approach or their views about when a child should return to school and more particularly return to sports. So what are the barriers and the challenges? So there are a number of these, which I've outlined on the slide. So first is recruitment in a very busy, complex environment such as the emergency department. And related to this is that the primary presentations of concussions are out of hours for researchers, so it's very hard to make sure that we actually recruit all of the kids who are eligible for our study early enough to meet our requirements. Secondly, there's a potential bias in retention. So what we're finding from our study is kids who become asymptomatic tend to drop out of the study before its completion, which leads to a risk of overrepresentation of children with poorer outcomes, which is clearly a significant problem for understanding the breadth of recovery after concussion. And thirdly is the issue of actually determining what recovery is. And currently that's generally clinically based judgments with no agreed method for quantifying recovery at present, despite there being a number of questionnaires and so on that are completed. From the clinical perspective, there are risks to quality of care. I've mentioned the fact that there's no evidence-based child-focused clinical management guidelines available. There's also very poor community understanding of what concussion actually is, which is really fueled by a bias in media coverage of the consequences of concussion. There's poor implementation of official policies regarding sideline management, and there's a lack of acknowledgement by clinicians of the role of psychosocial temperament factors in slowed recovery. So what I'm hoping to get from this symposium is a multidisciplinary perspective on recovery from concussion and predictors of poor outcomes. I'm hoping that there'll be a sharing of ideas and problem solving around some of the challenges in the field, and most importantly, steps towards integration of current empirical knowledge to support the development of evidence-based guidelines for acute concussion management. Thank you.